Sawadee Khan, welcome to be my guest. The program which brings you successful stories of entrepreneurs and organizations in both domestic and international arenas. I'm Surosha Ratanapian. As healthcare has been one of the Thai government's primary concerns, SIPA Thailand responded to the country's policy by integrating the software technology to improve the healthcare system and to create accessibility to public healthcare service to the general public. So what PHR is and how it can elevate Thai citizens' quality of life, so follow me on this episode and be my guest. Currently I am with Kun Tam Naranong, the Enterprise Marketing and Promotion Manager of Software Industry Promotion Agency, or SIPA, and also Kun Rawat Wong Sisang, the Senior Analyst and Project Manager of National Electronics and Computer Technology Center, or NECTEC of Thailand. Sawadee Khan. So first of all, could you introduce yourself to our fans to be my guest?
Right. My name is Tam Naranong from SIPA.
My name is Rawat Wong Sisang, Project Analyst and Project Manager of the PHR project from NECTEC.
Okay. Before we are going to know more about PHR, so what are your responsibilities right now in your organization?
I'm actually looking after the marketing, enterprise marketing department. So we are focusing mainly on 6 industries. Healthcare is one of our targeted as well.
For the NECTEC, we are the research organization under the umbrella of the NASDA, National Science Technology Development Agency, and we are the, one of the national center of NECTEC in the national and electronics. So the field that we working on the research is electronic and computer.
Okay.
So you asking me about the field that we convince we get into the health. Because we focus in healthcare also, and we do research in the National Health Information System before, and this is the one that project that we join with the SIPA to do it.
Okay. So it's collaboration between SIPA and NECTEC.
Right. Yeah.
That's right.
Okay. When we talk about PHR, and regarding PHR, many people might be wondering right now what PHR is.
All right. Let me answer these questions. And PHI is actually stand for Personal Health Record, right? Those who are in healthcare industry might know it. It's the meaning of PHI is actually the content of the content of the information regarding to the healthcare for the personal use, and it's different from the electronic medical record. That's is a content for the healthcare as well, but it's actually managed and maintained by the professional in healthcare or official agencies. So PHI is more closer to the citizens. The idea to do the PHI is actually we step back to our roles. For the SIPA, we are supporting the use of IT in every sectors. Personal health record is one of the things that we aim to adopt the IT into the healthcare industry in Thailand. So we initially start off thinking of the electronic medical record, and then we found out that we still contain some of the sensitive information in the healthcare information. So we scale down that into personal health record.
Okay. So what kind of information or content that public can get access to when we talk about PHR?
Yeah. The main purpose of this project that we try to build a service platform that can be used in the field of the public health, especially for the people or citizens of Thailand that can access into its own data. That we try to build a system that is the best for the citizen.
Okay, so it's a service platform in terms of in order to improve the healthcare industry
That's
in
right.
Thailand.
That's right.
Suppose, okay, I want to register, in order to check my own PHR or personal health record. So what type of information do I get after the registration?
Well, as I mentioned, this is the first phase of the project, so quite some selected information that being available in the PHR
I see.
platform. For example, gender, male or female, your name, your surname, your blood type, your, for example, the NCD non-communicated disease. For example, when you have a headache, you go to admit to the hospital, you get some medical from the medicine, from the hospital. That are stuff that you can get from the PHR.
I see.
But we are not get into the serious, disease. For example, HIV and that stuff. You cannot
Okay.
get that.
I see. Okay. What about if I am a cousin, of those who have registered PHR or personal health record? So can I get access to my cousins or my family members' information?
Actually, you cannot access to the other data. The system that we design is particular for his own data only.
Okay, maybe
But-
it's for safety reasons.
Yeah,
That's
for the privacy and security reason
I see.
under the regulation of all law that
Okay. Okay.
restriction. And the system, as Kunmitam mentioned, we try to keep the primary data for a particular person to be in the primary personal health record.
Okay.
But we also try to design other side of the data also that will benefit for them also, like the activity data that will relate to the healthcare system also that is going to be to use in the future.
Okay. So where, how? Oh, excuse me. Okay. So where can we get the information, of personal health record here? In hospitals or?
There are two types of information in personal health record. One of them you can get it by accessing to the health data center, which is when the doctor diagnose your disease and give you some medicine, they need to write down what the prescriptions and that stuff. By having that, we can access to that information. That is one part.
Okay.
The other part is, as Kun Thiravat said, we can input some of our health informations. People these days, quite concerned on health, right? So they do a lot of, working out and that stuff, So and also some of the food as well. So with this system, we can allow them, to put, for example, how long have you walked today and how long exercise that you have been done and what food you eat to calculate the calories as well. And that is good for the healthcare record because if you go to see the doctor, right, for example, annual checkup, doctor tend to ask you whether, how often you do some exercise per week. You may say, once or twice a week, something like that. But they didn't know, how long or how hard of the exercise that you did, right? But with the personal health record, if you input information, the doctor can see the history
I see.
of how you eat, and how you exercise.
So technology is now spreading,
Right.
in all areas, not not excluding, I would say, the healthcare industry of Thailand. And regarding the process, or steps in implementing, this technology of PHR. So could you tell us more about the process from step one, until the present time of PHR?
Okay. The step that we working in the first phase and the second phase, we work closely with the Office of the Public Health in Prevention Ministry Office, Nakhon Nayok. We work with the technical team over there. And we start from keep requirement of the user, both from the people and the caregiver of the Ministry of Health office. After that, we design the data set and user interface of the program. It's gonna be look like, and we work together, and we test it, and we connect the data from the health data center of the province and sync it into the PHR system that we design.
Okay.
After that, when we use the system pilot, we test it and train the user to use it, and it's gonna be there.
Okay. So the pilot project was done already in Nakhon Nayok province?
In the first phase, yes, in Nakhon Nayok.
Okay.
And then we are in the process of expanding it into 4 more provinces. For example, in Phetchabun in the north, Roi Et in the northeast, Kanchanaburi in the west, and aligned with the Smart City project from the Ministry of ICT, we pick up Phuket. Is one of the pilot cities as well.
So what are the reason behind the selection of these 4 provinces in launching or implementing the new phase of PHR?
Readiness, I think. We has been discussing with many, provincial office, but we need to check up as well whether they are ready, to apply this kind of platform into the system.
Okay. And from the pilot project in Nakhon Nayok province, so were there any challenges or difficulties or things that you have to be, consider or concerned about?
Well, a lot actually, because this is the first phase, and our project is actually start in Nakhon Nayok. One of the most challenging things is actually how to get the requirement from the medical doctors, from those who are in the healthcare personnel and that stuff. Quite difficult because it's new, and as you know that the healthcare information is quite sensitive. By misuse information, the officer or even medical doctor can be sued as well by law. So we need to clarify which information can be put into this platform, which need to be keep away until we have a law support or something like that. So that is one of the most important thing. The other one is to convince people to use it, because it's quite difficult. IT is quite difficult, especially in healthcare. People tend to concern other things rather than IT. But thanks to Steve Jobs actually for the smartphone, that a lot of people now familiar with the smartphone, so they can use it easily, with games or with other entertainment applications. So they're not afraid of it, So when we have it and then we develop it interface with the smartphone or iPad, people tend to be concerned about it. And try to use it. But that will take time.
But for now, it's time for a short break. We'll be right back, and when we learn more on the contributions of PHR to the community of Thailand and how we can register in order to be a part of PHR project. So please stay tuned and be my guest. So welcome back to Be My Guest, and I'm sure Kun Nitam and Kun Thirawat, the 2 key people, who are enforcing, the implementation of PHR or Personal Health Record of Thailand. During the last break, you have given us, a very clear background on what PHR is, and also, some benefits, I would say, that citizen, as us, can get access to. So for this break, I would like to know more about the registration process. Suppose I am a Thai citizen and I really want to register in order to get access to my personal health record or information. So how can I register with the record system?
So we design the process that when people want to use the PHR system, they have to contact with the public health office first to open the system. The people have to sign like a sign consent document first and agree to open the data for the PHR. After that, the officer will open the data, and that is you're gonna use it after that.
Okay.
But currently we can use only in 5 provinces. As I mentioned, Nakhon Nayok, Phuket, Roi Et, Kanchanaburi, and also Phetchabun only.
So that means, do we have, my house certificate which register my name? Okay, should it be of that provinces only?
That's right.
Yes or no?
Yes. Right.
So that means if I am a migrant worker and then I work in other provinces, so I cannot get access
now
to my personal health records.
That's right.
Okay. And the next one will be regarding expected outcome of PHR. So what are the expected outcomes? So what are the milestones that you are aiming for?
Well, the outcome that we expected, of course, we want Thai citizens, to use PHR more, so that we can, as a government, we can get the information, right? And we use that information to analyze and also issue the policies that suit with the situation right now. And the number of the citizens using this system, one of the outcome as well. And secondly, we would like to expand it, the PHR, not only in the specific province. We try to do it nationwide, right? So people, if they born in one provinces and then need to work in the other provinces, can still using this kind of services as well. Right?
Okay.
For the viewpoint of the NBT, we are a research organization. We hopefully that the platform that we design, the PHR, is going to be expanded used over all the country. That is our expectation for the society.
Okay. You mentioned previously that one of the obstacles in Thailand right now is, people do not use the technology that much, in Thailand. So, how do you plan, to promote PHR to make people more aware and become more, familiar with PHR in the future?
Well, by doing that, we need to collaborate more, actually, not only SIPA and NBT. We may need to work with Ministry of Public Health and also the Public Health Provincial Office, and also the Thai software vendor as well, try to expand the use of PHR project, because right now it's still on web-based services. So if it can be developed further with the mobile applications, which is easy to use for the Thai citizens, then we think that a lot of people can, fill in their, information a lot easier than what they did at the moment. So basically, I think there is a collaboration between government agencies to boost up the use of IT. And in terms of the Thai citizen as well, I think we need to do more some of the promotions, in terms of to convince the Thai citizen, to use it and see the benefit of using the PHR for their own, and also maybe not for their own, information they can share with the families and that stuff in the future.
Okay, so the use of technology might be able to spread from younger generation to their parents or their grandparents' generation. And when we talk about the current situation, what are the governmental organizations or agencies that are cooperating right now in order to make a success of PHR?
Right. Right now, we start off at the Ministry of ICT and also Ministry of Science and Technologies. I think in terms of the high-level talk discussions, Ministry of ICT are already discussed with Ministry of Public Health, and then we are having some of the small meeting also with those who are in charge for this kind of project under the Ministry of Public Health. so-called Center of Information Technologies and Communications. So we try to convince them, to use this system. But as I mentioned, we start off with the provincial level, so we probably need to do some adjustments or modifications in terms of the PHR as well, to align with the policies from the Ministry of Public Health.
Okay. And when mentioning about the government policy, so how PHR, goes in line with the government's policy?
Well, under the Ministry of ICT, we try to promote the digital economy, right? So healthcare is one of the things that they are not generating revenue, but actually if you use IT, then maybe you can reduce sort of, funding or expense in the healthcare industries. I have been told that in the last 5 years, the number of the expense on healthcare has been increased. So by adopting PHR, we hope that the government get the information, the real information that they can use to, project and also to make the policy that suit with the current situations. And we hope that the expense will be reduced.
Okay. And Kun Thirawatt, and apart from the use of the, this project in personal health, a data check-up, or all the personal use, okay, it can also be used for other purposes as well, right, when we talk about personal health record?
Yeah, we expect to use for the other application also, like referral system or some kind of the other kind of the application that will be occur in the future. I think we design like a basic of the standard data set that it's going to be used for other kind of the system also.
Okay. So what type of applications can be, applicable in this case?
Like application for the insurance application, such as right now I think maybe application like this.
I see. Okay. And it can also be used in terms of statistics as well.
Yes.
Right. So could you explain a little bit more on, the benefits of PHR in that sense?
In summary, I think there are benefit for kind of the people. People in its own, you have the access to its own data. For the management level, they can use some kind of the information from the PHR system to do like a planning, a strategic planning, or improve the management in the healthcare service for back to the citizen.
Okay.
And also for the regional or the national level, they can use the basic information from the PHR system to do like a planning for the budgeting or some kind of the control of the disease or something like that in the future as well.
Okay, I see. Okay. And apart from that, I think this will be the last questions, which is about the future phase of PHR.
Well, the future is actually we try to expand it throughout Thailand. So we need to work along with the Ministry of Public Health and convince them. Actually, we have been discussing with them for 2 months. So we hope that the conclusion will be made by the end of this month. And with the support from the Ministry of Public Health, then I think we will be able to expand it nationwide.
Okay. So that will be in a short or medium or long-term plan?
Well, it's supposed to be as soon as possible, right? But in reality, I think that need time, to do it, because it's touch upon the infrastructures of the healthcare industries. It also affected to the systems that we having at the moment, and also the policies as well need to be changed.
Okay.
I think the policy issue is the main theme that we try to conquer right now. If we get support from the public health, I think it's going to be nationwide, as Mr. Kun Vitam mentioned.
Okay. And however, I believe that all of Thai citizens are looking forward, okay, to seeing and also playing and also interacting with the new PHR, okay, which is coming really soon, okay, to them and also to Thailand in 5 provinces. But for now, thank you very much for your time today.
ขอบคุณครับ
So in the near future, you can get your own and get access to your own personal data in terms of your healthcare information. Moreover, the creation of more software technologies such as PHR support the increasing occurrence of software entrepreneurs and deliver a new market competitive advantage and environment in the software industry in Thailand. But for now, it's time to say goodbye. Thank you very much for watching us and tuning in on Be My Guest. For more information, you can log on to thainews.prd.go.th/en. I'm Sarosha Ratnapian. สวัสดีค่ะ